And Reno. You're watching 2 News at 5.
Good evening, I'm Kristen Remington.
I'm Ryan Kennedy. Thanks for keeping it here tonight. Washoe County saw 263 new coronavirus cases today. That comes along with 4 new deaths, 265 recoveries, and that brings the total number of active cases down by 6. Since October, though, October 22nd, the number of active cases in Washoe County has more than doubled from about 1,500 to more than 3,800 and has been rising more often than not. Brian Hoffman joined us live at Windy Hill with a look at the increase in cases in our area and the Truckee Meadows COVID-19 risk meter increasing to the very high level. Brian.
You know, Ryan, in a meeting about that risk meter, the mayor and other healthcare officials warned caution and vigilance against the spread of the virus and warned that hospitals could be overwhelmed with patients in the coming weeks. The mayor did tell me that if the numbers keep on increasing, that we may see some other closures.
If we don't, we will be closing businesses. I think a mask mandate throughout the entire city of Reno is imminent.
Doctors and medical professionals that were also on the call cautioned about the increase in hospitalizations that they're seeing.
Just about 2 months ago, we were averaging about 50 hospitalized patients per day with COVID in northern Nevada. That is well over 200 now. We're approaching 250.
With this much strain on the medical field, combined with the shortage of healthcare workers, crisis care models are being discussed as well.
Crisis standards of care is basically it's a point system that is developed to decide who gets the ICU bed or who gets the ventilator in the event that we have a shortage.
Mayor Sheevy says that she wants to avoid this model at all costs.
I don't want to be here in 2 to 3 weeks and telling you that that is what all the hospitals have implemented. I mean, how incredibly tragic, absolutely tragic.
And while in the beginning it was rare to see children suffering from the virus, doctors are starting to see an increase.
These are critically ill children with this illness. So it is not just old people that get this.
The group working on the risk meter now has over 200 days of data and are making adjustments to how they measure the risk meter, including updating the meter on a weekly basis.
They are going to be tough, but we are absolutely begging you. Your medical community has been there for you. Now we all need to be there for them. And I can't stress that enough to our entire community.
The task force is also working hand in hand with the Washoe County Health District as well as other healthcare professionals to possibly get some type of future updates that allow us to take a look at how the virus is going to do in maybe a week ahead of time to allow the community to see how their efforts are really doing to slow the spread. Covering the story live, Brian Hoffman, 2 News.
It could be a powerful visual. All right, Brian, thanks.